Welcome to Health+Tech, the show where we explore the law that applies at the intersection of healthcare and technology. Your hosts, Janice Suchyta, Andrea Lina, and Jonathan Ishii, are healthcare attorneys and partners at McGuireWoods LLP, a law firm of 1,100 attorneys with offices throughout the United States and the world.
Hi, everybody, and welcome to another episode of the Health+Tech podcast. I'm Janice Suchyta, and I'm a partner at McGuireWoods Law Firm, and my practice focuses on digital health and different matters regarding digital health for healthcare entities. And I'm so excited today to have one of my colleagues in McGuireWoods join us today, and we're going to talk about telehealth legislation, trends, what's been happening during COVID, and what we can expect for telehealth platforms to evolve when we will move on beyond COVID, which I'm sure we will someday soon. So I'm going to introduce Michele Satterlund, and she is with McGuireWoods Consulting, which is another aspect of the McGuireWoods law firm. And welcome, Michele.
Thank you, Janice. And as you were talking about COVID, I was looking around the room for some wood. The table's granite because I think we need to knock on wood. We've got to get rid of this this pandemic and move on with our lives. But I guess telehealth is really important during a pandemic. So this conversation is really timely, and I thank you for inviting me.
Well, I'm just thrilled to have you here. And before we get started, just introduce yourself to our audience and tell everyone what you do at McGuireWoods Consulting.
Sure, thank you. And it's great to be with all of the listeners here. As Janice said, I'm Michele Satterlund. I'm a partner at McGuireWoods, the law firm. But more unusually, I am a senior vice president with McGuireWoods Consulting, which I just say is a fancy way of saying lobbyist. So I am knee-deep in the bills that are introduced and discussed, and some pass and some don't pass in state legislatures. And one of the areas that I've been very active in is technology healthcare, and that always encompasses everything telehealth, and that I use telehealth very broadly. There is so much that goes under it, but I'm have been very fortunate to work on some really interesting issues and excited to talk with you about those, Janice.
Well, I'm excited too, because in my practice with digital health, we have seen so many clients state, I had to start telehealth as an emergency because of the need with COVID, and my patients needed it. And now it's evolving into a platform where individual providers, large health systems, and digital startups are looking at having a telehealth platform on a national basis and using it forever, so to speak. So I thought it might be interesting to start with, how did the telehealth emergency and the waivers, and how did all of that start during COVID-19? As we all heard, gosh, almost 2 years ago, hard to believe. How did all of that start and during the public health emergency? I think that would be really interesting to start with.
Sure. So, it's really interesting. Telehealth for the last decade, even 15 years, it's been gaining traction, but I would say tiny traction. As a working mom, I love telehealth and have been an ardent enthusiast of of using telehealth because I have 3 children and I work during the day, and being able to get a medical consult has been a lifesaver for me. But I think for many, many years, I don't know if I'm an anomaly, but it wasn't sticking in the way I think many industries had hoped. But in the last 5 years, you've seen a trend towards more use, but the pandemic just really accelerated that use. And part of that, it was just an absolute necessity. You had individuals in rural areas or urban areas where healthcare providers simply weren't seeing people, and the only way to do it safely was through a virtual visit. But as often happens, every state has their own idea on what works for telehealth. And there have been there's a hodgepodge of different laws that are out there governing different aspects of telehealth. So if you're, some states can have a law that, you can allow prescribing, but if you are an optometrist, you can't do it. Or if you're working in behavioral health, it's a different set of rules. So even it gets so granular that even though you've even have numerous laws, it can get even deeper on each particular type of provider and what they're doing with it. So enter the pandemic and you have this variety of patchwork rules and regulations. And what was so interesting, because as a lobbyist, I see across the nation, people are actively advocating for change. And then in about a 6-week period, we saw numerous states turn or pause laws that had been very restrictive and that various stakeholders had worked on forever through the use of executive orders. And governors realized that they had to put quickly in place, remove barriers and put in place more expansive laws that would allow for a greater use of telemedicine. So you saw across the nation all of these executive orders that really underscored what the stakeholders had been trying to preach for a long time. Telehealth has a place, and we really saw that during the pandemic, particularly the early months.
Yeah. So COVID starts March 2020. We are now into almost September of 2021. So we're still under the public health emergency. How do you see, let's just stay with state legislation. How do you see the states handling, one, unfortunately, COVID and the public health emergencies dragging on? How do you think the state legislatures are going to respond as we move almost into the second year of this pandemic?
It's interesting because, so I'll use Virginia as an example. The Virginia executive order put in place a modality neutral language. So it said any type of technology that is public facing can be used to deliver a telehealth consult. And that's pretty amazing because there are often limits, which is unbelievable to me, but there are limits on the type of technology that can be used. Some require video, some states require video, some states require audio. Some are very clear that you cannot use chat or text. But
Right.
this particular executive order said, use whatever works. I think it will be hard in states like Virginia, where folks had a taste of what can be allowed, to put the genie back in the bottle. And so I think in this upcoming legislative sessions, which across the nation typically start in July, you're going to see numerous bills introduced that say, hey, we gave the public a taste of accessing healthcare on their terms. How do we now say, oh no, that doesn't work? Do we have data that says, physicians and nurses didn't deliver quality care? There's no data like that. So I think we'll see across the states more legislation aimed at removing particular barriers, looking at reimbursement, scope of practice, trying to get more uniform laws across the state so that the industry that wants to use this platform can do it easier. Now, will it be hard fought? It will be, but the genie's out of the bottle.
And I like the way you said there are different barriers. So what do you think, even before COVID, what was the biggest barrier for a telehealth model?
So, in fact, I talked to an industry client this morning who is knee deep in all states. She covers all of the states. And I think it really depends on what your particular telehealth service is. For some, that's reimbursement. Reimbursement continues to be an issue, both at not so much commercial payers, but with Medicaid and Medicare, that continues to be an issue. There's not always parity for a telehealth consult. If you're in the ocular care industry, that's still very different than primary care. So there are rules related to, or certain states that have prohibitions against even doing an eye test virtually. It really depends. I think, right now many industries think the staying in state requirement is one of the biggest barriers, particularly because there's a shortage of healthcare professionals across, whatever the profession, whether it's ocular, behavioral health. We don't have professionals who are trained and ready to go. So accessing them where they're at is really critical. But there are rules in place that a professional has to treat the person in the state, has to be licensed in the state where the patient is. And, in a virtual consult, does that make sense? And how can we fix that? Can there be compact legislation, which we're seeing more of across many more states adopt compact legislation that will allow for licensure portability. And I think we'll also see telemedicine utilization skyrocket once there's more licensure portability.
And that's a good point. I'm advising clients, and the first thing they want to talk about when we're trying to develop a telehealth model for them is the interstate medical license compact, and who is involved in it and who is not. So at this point, I think there's about 39 states, but another barrier for that is it's not automatic. So even though I'm Dr. Smith in Texas and I'm going to want to do telehealth consults with patients in Pennsylvania, even though Pennsylvania or another state may participate and recognize the interstate compact licensure, that doesn't mean it's automatically portability. It just means that your credentialing for your licensure is going to go through quicker, but it's still going to be many, instead of 6 months, it might be 3 months so that you can get licensed in Pennsylvania rather than just in Texas. Do you think some of the legislation now that we're seeing, at least on the state level, where they're going to try to expedite licensure across states?
Yeah, we're seeing renewed interest. The compacts have been under discussion for years, but I think again the pandemic accelerated that conversation. Where you're exactly right. The Interstate Medical Licensure Compact, it doesn't. If there's a national emergency and it still takes 2 months to facilitate the paperwork, how great is that? But we've been hearing a lot about the Advanced Practice Registered Nurse Compact, which to date, I believe 2 states have adopted and 1 just passed. And I think it's ready for signature by the governor, and I believe that's Delaware, or it's about to be signed. That will require 7 states to join. And so you'll have advanced practice registered nurses who will be able, in those compact states, once they get 7 states, to move more readily. And I think once that happens, once those 7 states are put in place, because advanced practice registered nurses can prescribe, because they can treat similarly to physicians, you'll likely see many telemedicine model platforms adopt nurse practitioners to utilize, because I think that's going to give them an edge simply because of the licensure issue. So I expect in 2022, you will likely see more legislation aimed at the Advanced Practice Registered Nursing Compact than maybe the interstate, just because I know there's a lot of push behind that. And you've got, this isn't narrowed just to healthcare. We're seeing it. My understanding is the Department of Defense is taking a real interest in this because of military spouses who are struggling when their spouses move. They've got to go through all of the hurdles to get licensed in a new state, and so it's becoming very problematic. And so I think with the Department of Defense looking at this issue, we may see some real movement coming faster as well.
Well, that's exciting. So I think we're seeing movement, at least on the state level. Do you think it's just going to be a state by state kind of long haul in regards to each individual state recognizing portability or recognizing that the compact, that they can join it?
I'm a state lobbyist and I like state issues because they move fast and furious. In this state, Virginia, the Commonwealth of Virginia, you have either a 45 or 60-day session from start to finish and a law is done. At the federal level, things tend to move at a much slower pace. And you can talk about telemedicine for many, many years before something happens. But I do know in the 117th Congress, I think the last I counted was approximately 43 bills introduced. I don't have a status update on any of that, but there's a definite interest. And I know that the Biden-Harris administration recently announced a significant investment in telemedicine. The federal, I believe it's the FCC, particularly, this was last year when they realized that folks couldn't access care because they didn't all have access to broadband. They made investments. You've seen the Department of Agriculture make investments. Folks at the federal level are really recognizing the importance, but I think it will take time. And so meanwhile, 2022 is just around the corner and states are just, I think, going to go after it on their own. So I think both are really important for clients to pay attention to. But I do think the speed happens at the state level. So that's where we'll see a lot of action.
Yeah, and that kind of makes sense. Do you think with the waivers, like we've seen CMS do the waivers for the telehealth, even the DEA for telehealth e-prescriptions across state lines, do you think the waivers, I think we could have a situation where the waivers are we're going into the second year. And I think they're going to be in place for at least well into 2022. Do you see on the federal level where they could just possibly make those waivers permanent, or at least in regards to the various regulatory agencies?
Yeah, I don't think anyone ever anticipated nearly 2 years later we'd be having a conversation. I certainly did not. I recall when my 12-year-old was first, sent home, they told me it would be 2 weeks. So I'm still counting on that 2 weeks in my mind. But I think that's a great point. There's clearly a need for the waivers. So making those permanent, that's certainly an option. I think at the federal level, again, it just requires a lot more discussion and it's just a slower pace to get through it. But, there certainly could be a possibility that those are made permanent, whether by, I don't know if that would be done by the administration or if folks would seek to do it legislatively through Congress. I think that those discussions are happening, but I think it'll be faster through the states.
Yeah, I think so too. Do you see, in regards to the telehealth, do you just see where eventually all 50 states are going to pass legislation and then you'll have licensure portability within all of them?
I wish that I could give you a magic number and say, oh yes, within 5 or 6 years, that will happen. But, every state in the United States of America prides itself on being its own unique entity with its own political culture. And
I live in Texas. Come on. So.
Oh, there well, and Texas was a state. I just talked to one of my clients, a telehealth primary care client, and Texas went screaming into telemedicine. They did not go willingly at first, but now it's a great state and they seem to be, all about telehealth. But I think you've still got some, Mississippi is not a great state for it. My understanding, Rhode Island has some quirky laws, I've heard.
Yeah.
So I think there's the licensure portability be roundly accepted by every state? Probably not. So I think you'll still see, it depends on who has political clout, what stakeholders stand to lose. And, frankly, a lot of states are looking to protect their own providers. And we saw legislation last year that when it was originally introduced here in Virginia that said, if you're going to use a telehealth consult, you had to go first to have an in-person exam with someone in the state, which just backwards. That ended up not passing and was amended, but it certainly underscored the fact that states have their own interests, and the professionals in those states, do they want to compete with all 49 other states? It's a question that has to be answered, and but they can't see. There's a shortage. That's a fact.
That's a good point. I was just advising some clients today. Everyone, like you and I have been talking about today, yes, states are moving forward. Everyone's on the telehealth bandwagon, the need and the emergency during COVID. But like you said, at the same time, and I've seen this too, it's very fluid. Some states are going to move forward, but at the same time, you're going to have more restrictive legislation, even during a public health emergency. So I'm advising clients, you have to be diligent and stay on top of it, and, make sure that you're researching. And when you're developing your model for the different states, it's going to be different in everyone. And I don't think we're going to have a federal model for a long time, do you?
I would agree with you. And that's really good sound advice to your client. Because
be careful.
If you just Google telehealth or anything related, it sounds like everyone's on the same page and every state wants to go forward, but the state laws are so very different, and you may have, something that you've created that is the best thing, but it may not comport with a state's laws, unfortunately, and you don't want to be excluded. So definitely, look at existing law, look at existing guidance documents. That's another thing, as as a lawyer, you can go look at the statute and that may say that, and then there's the regulation, and then there's guidance documents, and then there's meeting minutes for the various health boards that may give an interpretation that says something completely different. So it's never as black and white as we would love it to be. Sometimes the law is in between and it's very nuanced, and particularly as January comes around, clients, we advise them, be on top of those states, see what's introduced. And if you feel like it's going to be harmful to you, get involved. You need to reach out and become part of the process. And that's something, McGuireWoods Consulting as a lobbying entity, we understand how to help clients with that, but clients can do that on their own as well, and be active in the political process to protect your interests.
I think that's perfect advice. And even though there may be some obstacles and barriers to telehealth, I think it's an exciting model. I think everyone has to realize that these platforms, even on a national level, are very viable. It's just a matter of being careful and nuanced and getting the right advice to make sure that you're following with the fluid legislation and building the right model that's compliant in the states where you want to practice. But I think it's an exciting area because everyone wants to use telehealth. It helps patients. It just helps you and me, working moms, everybody. So
I agree completely. And I think as a working mom, I think the next best thing would be a telegrocery shopping. So send someone down the grocery aisle and tell them, pick this, and I would not have to leave the comfort of my home. Once we have that, I'll be set.
Well, I think Jeff Bezos would probably do that. So
I think he could. Someone somewhere's got that in the works, I'm sure.
Oh, that sounds great. Well, Michele, thank you so much for joining us on Health+Tech today. This has been a great conversation. And I hope if anyone has any questions regarding telehealth from a lobbying legislative point of view, or from the legal and licensure and compliance viewpoint, please reach out to us. We would love to help. And please join us on to hear this Health+Tech podcast and our other podcasts and our other guests. You can listen to us on the McGuireWoods website. We are also on Spotify, iTunes, and YouTube. So again, thank you, Michele, and for a great conversation about telehealth. And I hope everyone will join us again for our next Health+Tech podcast.